Okay, thank you very much. When you see when we have cases, increased load of patients, obviously the quality of care will deteriorate. So this has been a few PKRC has been reported in terms of the food, in terms of the services, in terms of the hygiene, and etc. But nonetheless, this is a very challenging time for Ministry of Health to manage a large number of patients, for example. But we are not doing it on ourselves, so we are working closely with NAPMA, MKN, and etc. So we hope that we can improve the situation. Certainly it can, but give us time for us to look into the logistics, and also we are looking seriously to consider other options. For example, if the PKRC mainly for foreign workers and perhaps the local, we can actually put them, place them in our quarantine center in the hotel, just like what we did for PUI and etc. Coming back from overseas, returnees from overseas, that we have done that. So we are working closely with NAMA to sort the problem out. So, but nonetheless, our concern is the cases are increasing now. So when the cases increase, so this is the challenge that we have in terms of the health system being pressured at the moment. In the hospital, in our clinic, and etc. and ICU. So you can see today ICU beds has patients the number of patients is increasing in the ICU beds as well as ventilated patients. So what we need to do is, yes, we need to enhance further to open up more wards and ICU beds, but we also need to look into our logistics in terms of human resource to manage the patient. But more importantly is to control. We need a circuit breaker to control, to bring down the cases from 2,000 maybe down to 200 before we can actually manage the whole situation better. So we are looking to different strategy now. Discussion is ongoing, and we need MKN to make a decision and then to take actions as soon as possible so that we can manage the situation much better.